Hello, I'm Dr. Kanika Gupta, gynae oncologist, Senior Director at the Max Hospital, Patparganj. Ovarian cancer, if we talk about, it is the third commonest cancer for a female. We have uterus, that bachadani and all. In both the sides, we have an almond-shaped white color structure which is called ovary. And what is the role of ovary is? The ovary contains number of ovums which are there for every month to be fertilized, and during this process they secretes hormones also, and these hormones are not only for the reproduction purpose but they help us in reducing our heart disease rate, in depositing the calcium in the bone. So the ovarian has definitely different roles to play with, and when something happens to this ovary, the DNA is damaged and there are multiplication of these cells starts occurring, the ovarian cancer starts. So if we talk about ovarian cancer, generally it is seen in three varieties: an epithelial tumor, the germ cell tumor and the stromal cell tumor. The germ cell tumor and the stromal cell tumors are very rare, but mainly what we see is epithelial cell carcinoma of ovary, which are again of different varieties like mucinous, endometrioid and serous and papillary serous, and that can be of different grades, like they may be of low grade potential or high grade serous. So it all depends what cancer we are seeing in that particular woman. If we talk about symptoms of ovarian cancer, no one particular symptoms can be said that it is because of ovarian cancer. There are multiple problems which can be attributed that later on, yes, the ovarian cancer was there, it has already been started, and that is the reason why we get ovarian cancer generally in stage 3. 80% of the time they come very late, and because there are no symptoms. To start with, if you have frequency of micturition or urgency of micturition, a constipation, gastritis, feeling full, you have started eating, loss of appetite, loss of weight, fullness of abdomen, they all can be contributed because of ovarian cancer. We can't say that ovarian cancer is related to one particular thing, like your lifestyle. Yes, if there is obesity, the ovarian cancer is going to be more in obese women. The early menarche, if your menstrual cycle has started in early and you have a late menopause, delayed menopause, you have more hormones, more the ovulation, the chances are that yes, you may develop ovarian cancer. Reproduction, if we talk about, if you don't have any kids or infertility is there and you are taking hormones to treat your infertility, the chances are again more. If you have not lactating your child, it can be one of the reasons. So this is all about lifestyle, the menarche, the menopause, and now what's about my family? I can't choose my family, but if somebody is suffering from ovarian cancer in my family, I have more chances to have ovarian cancer. If more than one, definitely the chances increases. So there are 5 to 10% BRCA1, BRCA2, Lynch type 2 syndromes. There are genetic defects which I carry with me, and the chances of me getting ovarian cancer becomes more. So can I diagnose this? Yes, definitely it can be diagnosed. If you are having somebody in your family, not only the ovarian, the breast cancer, the uterine cancer, the colon cancer, the pancreatic cancer, please be on alert. Need not to be afraid. It is what is needed is prevention. Go to your genetic counselor. They will check your genes and will let you know. If BRCA1 is positive, the chances are 65 to 70% that you may develop some form of cancer. If BRCA2 is there, 30 to 35% chances are there that you may develop later on some sort of cancer. So it's better to know about you, when the time, before the time, and then you can take a prevention in this. So once we know that woman is suffering from ovarian cancer, naturally so many questions comes in mind. The answer is, what is the type of the tumor, what is the grading of the tumor, and the staging. And what means staging is how far it has been spread. So if I talk about in a gross, I'm not talking the fine details, in gross, if it is limited to the ovary, one ovary, it is stage 1A. If both the ovaries, 1B. If it is spread outside the ovary on the surface, or it has been ruptured surgically or accidentally, it becomes 1C. Stage 2, if it is spread inside the pelvis only, either the uterus tube or the peritoneal surfaces. There is stage 3, when it is spread beyond the pelvis at the microscopic level or the macroscopic level, depends upon 2 centimeter, more than 2 centimeter, the lymph nodes are involved or not, the omentum or the peritoneum surface is involved, that comes the stage 3. And if it is spread beyond that in the liver, the lung or the brain, we call it stage 4. So this is how we do the staging. And why is this important to us? We know in early stages of any cancer, the recurrence rate or the curative rate is quite high. Even for ovarian cancer, if it is stage 1, 90 to 95% chances are that this may not recur and she is cured. And if it is diagnosed in stage 3 or stage 4, the recurrence rate is quite high, the life expectancy is quite low, so 40 to 45% we do say 5-year survival is there. So now once the ovarian cancer is diagnosed, we know how far it has been spread. So the treatment of ovarian cancer comes in only 2 forms, either surgery or chemotherapy. So what comes first? It depends upon what is the staging and how far this has been spread. If primary surgery, debulking surgery can be done, we call it cytoreductive surgery. The purpose is to remove all the tissue which we can see by the naked eye. So we do the surgery, we remove the uterus, tube, ovary, nodal dissection, omental dissection, and if needed, the colon has to be removed, the spleen can be removed, the appendix. It depends upon how far this disease has spread. So once the surgery is over, then she has been given chemotherapy that can be platinum based or platinum resistant chemotherapy, depends upon her tumor type. And other way around, we can do a neoadjuvant chemotherapy first, downstage the disease. When this disease is downstage, and then interval surgery debulking surgery can be done, and then remaining chemotherapy can be given. So can you do something to prevent this cancer? No. Such, because we don't know much about this. If we talk about screening, yes, lifestyle, you can reduce your obesity and all, smoking and all. So if you have any symptoms persisting more than 3 weeks, please go to nearby your physician, your gynecologist, your GI people. Don't sit with it. This needs a diagnosis, and if it is diagnosed early, we have already discussed, the treatment is quite complete. So don't be afraid. Be on preventive side, reduce your obesity. That is what is in your hand. And if you are having a family disease, go for genetic counseling.